Well, October is Breast Cancer Awareness Month in the country and reflects a nationwide drive by public and private sector healthcare structures to raise awareness of this debilitating disease across all races and class structures. Both breast and cervical cancer have been identified as a national priority, with increasing incidences occurring. Approximately 19.4 million women aged 15 years and older live at risk of being diagnosed with breast cancer globally, the cancer affecting women in South Africa the most. But challenges to access and affordability of expensive breast cancer drugs and treatment remain. Professor Michael Herbst is the head of health at the Cancer Association of South Africa. He joins us on the desk this afternoon. Good afternoon, Prof. Always a pleasure having you on the desk.
Lovely to be with you again.
Prof, breast cancer leading the pack as one of the big 5 cancers afflicting women in the country. Talk us through the other 4.
Yes, just to mention quickly that at least 8,000 women were diagnosed with breast cancer in 2012. That's unfortunately the latest statistics we have. But then following short on the heels of breast cancer will be cervical cancer. And there approximately 6,000 women were diagnosed in 2012. Then third on the list will be a colorectal cancer, followed then also by cancer of the uterus, and surprisingly, lung cancer as number 5.
Prof, 8,000 women, you say, diagnosed in 2012. Those stats are staggering. How confident are you that a drug like Herceptin will roll out to eligible patients early next year? We know that the Department of Health, Minister Aaron Motsoaledi and his team have done some sterling work on this point, and they are trying to wrap up, finalize those talks with the major pharmaceutical Roche.
That's correct. And the minister has already announced that within the next 3 years, they plan to roll out the availability of Herceptin in all 9 provinces in the public sector. And that is absolutely a major, major step forward, because so many women depend on the availability and access to Herceptin to be able to survive.
And we do know that Herceptin costs about R500,000 just for a year's treatment.
That is in the private sector, yes. Very, very expensive.
So we do see government making good on its promises and coming forward with some concrete action when it comes to its new breast cancer strategy plan.
Absolutely, and I think we really have to congratulate the minister and his staff. They're doing a sterling job. And really, the contributions that they are making to women's health in this country is staggering, and really we can only praise them for the work they're doing.
But Professor, we're still seeing generally lower levels of awareness when it comes to our poorer women in rural areas who are more inclined perhaps to consult a traditional healer when it comes to breast cancer or cervical bleeding, etc.
Yes, I think a major problem there would be stigma. You know, there's still really a major problem within very rural areas in the country where a woman cannot come forward and say, I've got breast cancer or I've got cervical cancer. There's still stigma attached to it, in the sense that maybe you've been bewitched or something like that. And some of them are ostracized and expelled from the family. And they would then rather die in silence, which is absolutely so sad.
All right, we've had some high-profile cancer deaths when it comes to males in the past 2 years ago. David Bowie died of liver cancer recently. Alan Rickman just a few days later, also of pancreatic cancer if I remember correctly. Tell us why it's also crucial that we conscientize men in the battle against cancer.
Well, you know, men are the worst at health-seeking behavior. You know, they're very brave, and we think that we are the strong ones within society. But yet, when we are diagnosed, we are the first ones to lie flat in bed, and we want to be pampered. And really, if we could only change the attitude of men to come forward once they notice that something is different in their body today than it was yesterday or last week or last month, and that they would report, we can then have early diagnosis, early treatment, and a much greater success rate as far as cure is concerned.
All right, it's estimated that the annual cancer burden may increase to even 23 million cases.
In middle and low-income countries,
yes,
especially.
by 2030. What are some of the risk factors at play here, and how do we reduce our risk of contracting cancer?
You know, topping my list will be do not smoke. If you're smoking, please get help to quit. Smoking is not only linked to lung cancer, it is linked to so many, at least 5 or 6 or 7 different cancers. There is a link. Then also very, very important is to know one's body. If there's something different today than yesterday or last week, report it and get help. Then live a healthy lifestyle. Eat good, fresh vegetables and fruit in season on a regular basis. And then also get vaccinated, because there are wonderful vaccines available that can help protect and lower the risk and the incidence of many cancers in our society.
Thank you, Prof. We'll have to leave it there. Always a pleasure having you on the SABC News
Desk.
Thank
you very much.
That was Professor Michael Herbst, the Head of Health at the Cancer Association of South Africa, joining us right here on the SABC News Desk.